All right, we're going to go ahead and get started. So first off, welcome. Congratulations on your admittance to UC San Diego. We have been planning for new international student orientation for so long, and we're honestly just thrilled it's finally here. I know that many of you have been joining us for different sessions and webinars and events throughout the week, and I can honestly say it's been a joy to meet you. It's something that I don't know. It fills our cup with what we do to be able to actually meet you all, welcome you to our campus. So truly a heartfelt welcome. My name is Grace Fuller. I get to serve as the manager of student experience and engagement here at the International Students and Programs Office. If you have come to a few of our previous sessions or events, you probably maybe heard my intro a few times. So I'm trying to think of some new fun facts because I'm only so fun. Very limited fun. But truly, it's been so fun to meet you. And I do welcome, if I see you at an event, maybe we haven't had the chance to meet face to face, but I would really love the opportunity to get to know you. I feel like a lot of us are in this work truly because we believe that we're better together and that we belong to each other. So thank you for being a part of our campus community. A few housekeeping items before we jump in. So first, you're in listen-only mode, meaning that you can hear us, but we cannot hear you. So we invite you to submit your questions through the Q&A feature for today's webinar. Next, we are recording, so you'll be able to view this webinar recording as well as all other orientation webinars at inewstudentwebinars.ucsd.edu. And finally, we're going to do our best to monitor the Q&A, hopefully get all of your questions answered. But if for any reason you have a question outside of this space, maybe you can always contact us at icontact.ucsd.edu. It can be a question for our office, and even if it's not, we'll do our best to connect you with the folks who'll know the answer, because there's truly a whole network here of different resources here to support you during your time at UC San Diego. And with that, we'll go ahead and get started on today's topic of UC Student Health Insurance Plan, also commonly known as UCSHIP. We are so lucky and fortunate to have Jill with us today. And so I'm going to go ahead and hand it over to Jill.
Great. Thank you, Grace. Good morning. I'm so glad to have you all here, and I'm so happy that I get to partner with the ISPO in this effort. Hopefully, I'll be able to provide you with some information about our UCSHIP program, which just stands for University of California Student Health Insurance Plan, and provide you with the resources of our Student Health Center on campus where you can get health care. So our agenda today includes why do you have to have health insurance? I'm going to explain that to you. And we're going to navigate the Student Health and Wellbeing Clinic on campus. I'm going to provide you with some urgent care and emergency department resources to you in the event that you have an urgent situation, how to get your insurance card, some details of the UCSHIP coverage under the health insurance of Anthem Blue Cross, and I'm going to give you some resources and contacts where you can contact us if you do have any questions after this. So why do you have to have health insurance? As a requirement of all of the UCs, the UC Office of the President mandates that all students that register at a University of California college have health insurance that's comprehensive and covers you for primary care services, mental health, outpatient diagnostic services, and inpatient hospitalization. So for your protection as well as the campus, we need to make sure that we keep our liability low and that we keep you enrolled and on your educational journey successfully so you don't have a big financial burden. It is a requirement of registration that you have health insurance. And if you do have your own health insurance, the last day to file a health fee waiver to avoid paying the health insurance is Monday, September 25th. So please get those waivers in as timely as possible so that we can review your insurance and make sure that you meet the standards of the University of California. If you are keeping the SHIP, stay tuned in because I'm going to give you a lot of good information that will help you use that insurance as you need to. Under the health insurance, one more slide, please. I'm going to provide you with the insurance companies that support UC SHIP. The medical insurance is managed by Anthem Blue Cross. It is a PPO benefit, and I'm sure as an international student, what is a PPO? Well, that means that you have the versatility of picking who you want to go see for specialty care and hospital services, but you want to make sure that it's the most cost effective. So under a PPO benefit in the United States, you can pick who you want to see. There are other plans that restrict you to certain networks that you have to go to, but you have a very good coverage here and it's very generous. So Anthem Blue Cross is the insurance company. They are nationwide as well as they have international contacts. So if you are traveling abroad or you need to go home for break, you do have global coverage, and that's provided by Blue Card Worldwide. You would contact them before you go abroad, and they'll give you some instructions on what you need in order to access care. Under the dental plan, they give you $1,000 worth of supplemental coverage for curative services like cavities or root canals or having a tooth pulled out. It pays for you to have teeth cleaning, but it doesn't pay for braces or cosmetic care like teeth whitening. So in order to access dental care, you'd want to call the 800 number or go on their website. You plug in the zip code, and our zip code in La Jolla is 92037. It'll give you a list of the dentists that are participating, and you contact one of them to set up an appointment. You can use your student ID as your ID number. Under the pharmacy, prescriptions for medications are covered by Optum RX. Their phone number and website is there for you to look up their formulary if you have any questions on medications. And we have a full pharmacy at the Student Health Clinic on campus. If you have any mental health needs, I strongly recommend that you start with our CAPS, who is Counseling and Psychological Services on campus, and we partner with them through the Student Health Program. So you would contact them, set up an appointment with them, and you'll see a psychologist or a counselor. And then if you need a referral to an external provider off campus, they'll provide you with that. A referral is what a doctor or a psychologist or a medical provider provides you with if they recommend that you need another level of care. Under the vision benefit, we have a full optometry suite at UCSD Student Health, and we provide optometrists who can give you an eye exam. And we also have glasses and frames and contact lenses that you can pick out. The insurance will provide $120 towards that payment. You pay the rest of it. So these are some good resources for you to tap into if you do have any questions about the coverage of the health insurance. At our student health clinic on campus, we have about 30 providers that are medical doctors, nurse practitioners, registered nurses, available to help you with any primary care need that you have. So you'll always want to start your care here. This is a picture of the clinic on campus. It's located right on Library Walk. So if you're on campus now, check it out. We have primary care physicians that you can schedule appointments with, and you can do that by calling our clinic, or you can do that through My Student Chart and see one of our providers, establish care with them. If you are having any situation that you want to report to a doctor, set up an appointment and talk to the doctor, and they'll make the recommendation needed for your next level of care, whether it's a prescription for drugs or they'll refer you to a doctor of a specialty level. And we also have immunizations available at this clinic. So if you haven't met your immunization requirements, please schedule an appointment with our nurse clinic, and they'll assist you with the review of your documentation and provide you with the vaccines that you need. If you do need vaccines at our student health clinic, they're covered at 100%. So it's the best way to get them. Our doctors provide referrals, and referrals are required under the insurance for them to pay any specialty level care or hospital-based medicine that's not emergent. At our student health clinic, we also have a full laboratory where we can do blood draws and other lab services. We have an x-ray unit for skeletal x-rays. For pharmacy, we fill prescriptions, and if you need to transfer any prescriptions, you would contact our pharmacy and they'll assist you with that. And we also have our insurance department where we can assist you with any billing or coverage issues. We're here year round, so we don't take breaks for Christmas or winter or summer. So we're here right now and we're available to you. And we will be holding a flu clinic so you can get your influenza shot in the next couple of weeks. If we aren't open, then you want to contact our phone number that's listed there in red, and one of the registered nurses will assist you and let you know if you need to go to the emergency room or if you can wait until the next day to access care. All students are welcome at Student Health. You just are payer classified by having the student health insurance plan, or you're paying as you go as a fee-for-service patient. We can provide you with receipts so you can seek reimbursement from your outside insurance company, or you've picked up a raft through the waiver process. You're paying $70 in order to access care at Student Health and have scheduled appointments, lab services, and x-rays at no additional cost. If you do need emergency care or urgent care services, then can we go to the next slide? We have 3 facilities right around the campus that are hopefully within walking distance if you can make it. Otherwise, you would want to contact an ambulance, or you would want to Uber or take a bus over to these locations. UCSD is right around our campus, very close. We have UCSD Urgent Care, which is on Via La Jolla Drive, right down from our campus. And that's a $25 copay if you do see an urgent care. You don't need a referral for that. If you have an emergency and you need to go to an emergency room, UCSD emergency room at Thornton Hospital is here in La Jolla, and their phone number and location is there for you to set in your phone if you need that. And it's $125 copay to see an emergency room provider. If you are admitted to the hospital, they waive that $125 fee, and services are covered at 90%, leaving you with 10% of the bills for any facility charges. Under this insurance plan, you have 3 tiers of benefits, and we're going to talk about that. So everyone that's enlisted in UCSHIP has these 3 tiers of benefits available to them. So you start your care at Student Health. If the student health doctor says you need to go see a dermatologist, a skin specialist, or a surgeon, or any kind of specialty level care provider, they're going to provide you with a referral. And the referral is good for any provider that you pick. You just want to know how much you're going to pay out of pocket for that particular service. So under the UC providers, that's University of California, and that's statewide. You can access care at any of the University of California student health facilities, as well as their hospital systems. So if you use a UC provider like UCSD Health and you see a specialist, it's a $10 copay out of pocket. If you do have hospital-based care like an MRI or a CT scan, or you have a surgery, those services are covered at 90%. And there is no deductible, and the deductible is what you pay first, and then the insurance would pay their portion. But under this tier, there is no deductible. So you're either paying a $10 copay or 90% for any hospital care. If you see a mental health provider under this tier, it's a $5 copay. Under the second tier of benefits, it's Anthem Blue Cross, which is the insurance company, and they contract with providers all over the nation. So if you're outside of the California area and you need to see a provider, or if you're in California and you want to see someone outside of the University of California providers, you can contact Anthem at their 800 number or go on their website, plug in the specialist that you'd like to see and your zip code. And if they're contracted, it's a $30 copay to see that specialist. If you have any hospital-based medicine outside of the UC system, it's covered at 80%. But you do have to pay the first $500 of the bill, and that's that $500 deductible. So you pay $500, and then the rest of the bills are paid by the insurance company at 80%. If you're going out of network, the third tier of the benefits, which we highly discourage because that might set you back financially, there is a $1,000 deductible that comes into play immediately. So you have to pay the first $1,000 of the bills, and then after that, the insurance will cover 60% of any allowable charges, leaving you with 40% of the bill. So that's pretty expensive. And many providers under the Anthem Blue Cross Network and UC are available to you within a reasonable time frame. So hopefully you don't have to access any out-of-network services, but if you do, they're available to you. And again, a prior referral is necessary for any care that's received outside of student health, with the exception of urgent care, emergency room, dental care, and vision exams. So you can directly access those services without any payment issues. As a tender to the big ship, our little boat at the insurance team, we can help you with any billing issues that you're having or coverage questions that you might have. If you have any questions about the insurance that you have, you're going to want to direct those to the insurance company that you purchased the insurance through. But for the most part, we can assist you with referrals and helping you make the appointments through MyChart. Our doctors will report the referral to UCSD Health if they do write you one, and the specialty department will know that you're going to call for an appointment, so they'll be ready for you. If you go outside of the UC network, then we will print you off a paper referral that you can take to an outside provider. But again, please check with Anthem to make sure that the provider is covered under the insurance company. We want to make sure that you're safe and you're getting the care that you need in a timely fashion, and you're not paying too much out of pocket. To receive your insurance card, it's digital. I would say give it a few days, though. We're loading all of the students that have enrolled in the SHIP program currently. We officially start the fall quarter on September 25th. So I would say next week, if you want to try and download this app, Sydney, to your phone or mobile device, it'll ask you for your name, your student ID, and your date of birth. As long as everything matches up, it'll load a copy of your insurance card, the front and back of it. It'll allow you to look up providers, as I said, with Anthem Blue Cross, and it will also allow you to visualize claims that are being processed under your subscriber ID number with the insurance company. So it's very handy to have on your telephone. Present it to any provider that you go see, or if you have to go to the emergency room, make sure that you provide your insurance information so that they can bill timely and you don't get a surprise bill. If you do have any questions or you find difficulty in downloading this insurance card, please contact Anthem Blue Cross and they'll help you troubleshoot that. So before we wrap up, I just wanted to remind you to make an appointment with the student health clinic on campus. Go through My Student Chart and you can schedule appointments under the Appointments tab, or you can call our phone number and schedule an appointment, and that's 858-534-3300. You can look up providers on our student health website. It will give you a resume for our providers and give you a little bit of their background and maybe a subspecialty. And you can pick the provider that you want to see. So when you make your appointment, you can direct that appointment with that provider. And you want to secure a referral before you have any outside services outside of the student health clinic. You can do that by calling our provider, sending a message through My Student Chart, or seeing the provider and they'll give you a referral at the time of service. You want to make sure that you download that insurance card through the Sydney app, and you have that available if you do seek care anywhere. And then you also want to report any other insurance companies that you might have covering you so that they can coordinate benefits and pay your bills appropriately. Our last option is to give you our resources. We do not see students in person in the insurance department, but we will help you electronically, telephonically, and we also meet on Zoom so you can have a face-to-face encounter with one of our coordinators. So our offerings are provided there for you, and I know Grace has been so thoughtful in dropping URLs in the chat box so that you have those available to you and answering the questions as they come through. Our student health is open from 8 to 4, Monday through Friday. We extend hours on Mondays during the school year until 6 p.m. And then on Saturdays, our pharmacy and urgent care is open to students from 9 to 12. So that'll start next week. So now I'm gonna go back to Grace and I'm gonna see any questions that I can answer. And hopefully, if I don't answer them here, please hit us up on our phone number or email us or attend one of our Zoom sessions.
Mhm. All right, I'm actually going to leave it on this slide because I think there's a lot of helpful information here. But we have had a few really good questions come through the chat. So the first question we have is the cost generated by appointments at the school clinic covered by the health insurance? And I'm assuming they're referring to the UCSHIP plan.
Great. Yeah, good question. So, under the SHIP insurance, any service that you have at the student health clinic on campus is covered in full. The only thing that you are paying for at the student health clinic would be copays for prescriptions. And it's a $5 copay for generic drugs under their formulary and $40 for any brand name drugs that you secure through our pharmacy. So you're just paying for prescriptions at our student health clinic.
Our next question speaks to the UCSHIP flyer handed out during the grad resource fair, indicated that the vision PPO was Anthem Blue View Vision Insight. However, the slides say that it's iMed Vision, and the student is curious if there's been an update or a change when it pertains to the vision insurance.
They're the same company. So they do go by different names and depending on who you're talking to, but it is under the Anthem Blue Cross iMed. Insight is a sub company to iMed. So that can be a little bit confusing, but it is the same company. So please use the resources that I provided. I'm sure that the grad for that information is accurate as well. But if you do need an appointment, please contact our student health clinic because we can provide that to you.
All right, so I'm going to take a few moments to go through some of our outro slides, but I do encourage anyone attending, if you have like a last minute burning question, please do go ahead and submit that now. The fact that we have some face-to-face with Jill, she's such a content area expert that we really want to be able to answer your questions today. So I'll give you a few minutes to submit those questions while I go through some of our outro slides. So we have meetups. Meetups are exciting because they're hosted for students by students. So these are an opportunity for you to meet other students with like-minded interests. It's also fun because meetups are going to be happening this week as well as into next week. So a lot of our live orientation events are ending today and tomorrow, but meetups will continue to go throughout the week. All right, so we have some of you are already signed up for our UC San Diego bus tour. I know we had another bus tour last Saturday and it was a ton of fun, so we're excited to meet you there. Tonight is our International Student Fan Fest. That's our collaboration with athletics. So we're going to have a mixer before the game, and then it'll kind of roll into the women's volleyball game. A lot of the international student athletes that we have at UC San Diego are actually going to attend the Fan Fest, so it's kind of a cool opportunity. And then we have our International Mixer. So our International Mixer is one of our large-scale events that will be happening this coming Wednesday, September 27th, so next week. And we're really exciting. It's for both our incoming students as well as our continuing students. So it's really a chance for our global community here to gather. All right, so today is our last day of coffee hour during international orientation. So hope to see you shortly at 10:30. And then as a quick note, we do move to global coffee hour once a month during the academic year. And then a few of these mixers have already happened, but our gap mixer, so if you were enrolled in the Global Ambassador Mentorship Program over the summer, that mixer is coming up next Wednesday afternoon. As always, our iEvents calendar is the best place to receive some of that, like what's happening today, what's happening this week. So go ahead and bookmark that page and you'll always be in the know. And finally, we have an Instagram giveaway. So if you follow us on Instagram, like our post, and then share a picture to your Instagram story and tag us, then we'll go ahead and reshare it and you'll enter into our giveaway. We're going to be raffling off Amazon gift cards as well as some t-shirts. Okay, so we have had a few more questions come in, and I see that Jill is typing. Jill, any of these questions that you think would be beneficial to verbally highlight? Any points you want to reemphasize?
Yes, just so you are aware, if you do have insurance outside of the school and you want to use that instead of the school insurance, the health fee waiver is available to you on the Triton link under financial tools. Again, the waiver deadline, and that's when we close it for the rest of the fall quarter, is Monday, September 25th. So visit the Triton link as soon as possible if you choose to do that. I apologize, but we don't accept any insurance plans that are administered outside of the United States. We only accept US based insurance. So take a look at the application. And if that's something you want to do, please do it as soon as possible so that we can review your insurance. And that would be to avoid paying the health fee for the insurance.
Wonderful. Okay, with that, we encourage you to submit any follow-up questions to the contact information that Jill provided. And as always, you're free to reach out to us as well, and we will put you in touch. But thank you so much for joining us today. We hope that you arrive to our campus shortly, and hope to see you at one of our orientation events very soon. All right, thank you all.
Thank you.
Mhm.